Intrauterine insemination, popularly called IUI, is an effective fertility treatment for the infertile couple intending to become parents where sperm are placed directly into a woman's uterus. It increases the likelihood of pregnancy in certain infertile couples facing difficulty getting pregnant. As we all know, sperm travel from the vagina into the uterus through the cervix and up to the fallopian tubes in natural conception. In IUI, sperm is collected from the male partner, washed and concentrated in the laboratory, and then directly placed into the uterus closer to the egg to facilitate fertilization. IUI increases the number of healthy sperm that reach the eggs in the fallopian tubes during ovulation and eventually increases the chance of fertilization. The process starts with collection of semen. Once collected, the semen sample is then washed in the laboratory to concentrate the sperm and remove the seminal fluid. IUI is performed near the time when the woman is ovulating. The IUI procedure is relatively simple and only takes a few minutes once the semen sample is ready. A catheter, that is, a narrow tube, is inserted through the cervix into the uterus and the washed semen sample is slowly injected. Usually, this procedure is a painless procedure. Next, we'll discuss about who needs this IUI. Unexplained infertility in a couple. Low sperm count or poor motility. Inability to reach the egg. Mild endometriosis. Infertility due to the absence of ovulation. Infertility due to changes in cervical mucus. Abnormalities of the cervical canal. Patent or open fallopian tubes. Inability to have intercourse. Disability, injury, difficulties in erection or ejaculation. Couples who want to avoid passing on a genetic defect from the male partner to the child. Same-sex couples or a single woman wishing to conceive. IUI is not recommended in women who have advanced maternal age, severe disease of the fallopian tubes, tubal blockage or severe tubal damage, history of pelvic infections, moderate to severe endometriosis, diminished ovarian reserve. IUI is also highly not recommended for couples with male factor infertility unless they go for donor sperm. As a woman ages, the conception rates drop due to egg quality. Because of this, IUI isn't usually recommended for intended mothers over 40. For women in their early 30s or younger, the success rate is around 20 to 25%. For women aged 30 to 35, the success rate of intrauterine insemination is typically 15 to 20%. Women aged 35 to 40 have a 10% success rate of becoming pregnant after IUI. Women who have irregular menstrual cycles, other underlying fertility issues, and PCOS rate would be 15%. Male infertility success rate would be 5 to 6% per cycle. In mild endometriosis, the success rate is 10 to 12%. In case of donor insemination, the success rate would be 13 to 15%. What are the different factors that determine the success of IUI? It can be difficult to predict the success rate of IUI as every couple has a different response to it. Some of the factors that can influence the result are:
age of woman, proper monitoring of the menstrual cycle and the timing of HCG injection, choosing the right time for insemination, technique and accuracy in the collection and preparation of semen sample, type of medications used to stimulate the ovaries, causes and duration of infertility, sperm count and quality, and other undetermined factors. What are the possible side effects of the IUI procedure? Infection. This procedure often results in bacterial infection in the uterus. Spotting. While inserting the catheter into the uterus, there may be slight bleeding caused by minor injury at the vaginal opening. Multiple pregnancies. Artificial methods have the potential for multiple unintended pregnancies. Ovarian hyperstimulation syndrome or OHSS. This condition causes several symptoms such as dizziness, nausea, shortness of breath, weight gain, abdominal heaviness, abdominal pain. What are the types of medications used in IUI? Two types of medications are used in IUI. Oral medications like clomiphene citrate or letrozole. These medications are used from day 3 to day 7 of the menstrual cycle, or from day 5 to day 10 of the menstrual cycle. Injectables like follicle-stimulating hormone (FSH). FSH injections are given when oral medications fail to stimulate the desired response. Let's understand the reasons behind an IUI cycle failure. An IUI cycle may fail due to the following reasons: advanced maternal age, endometriosis, poor sperm count, low egg reserve, problems with fertilization, low progesterone levels, unavailability of sperms at the right time. What to do once an IUI cycle fails? Don't suppress your feelings, open up and talk about them. Share your feelings with friends and family to ease your emotional burden. Calm your mind in spiritual ways if needed. Discuss with the doctor why this happened. Correct your mistakes and try again using the right method. Get a second opinion if necessary. If repeated IUI cycles fail, consider opting for the IVF procedure. Seek a second opinion if needed. Maintain a stress-free mind through practices like yoga or other relaxation techniques. The following tips must be followed to achieve success in the IUI procedure. Eat healthy food. Avoid alcohol. Do regular yoga exercises. Keep yourself calm. Overexcitement is bad for health. Take your prescribed medication regularly. Stay happy. After the IUI procedure, couples can engage in physical intimacy as they normally would.